Back to school. Spotlight on youth mental health. The school bell rings, children's laughter fills the air, and another school year begins. However, the new term brings with it not only academic challenges but also potential mental health battles for many students. As parents, educators, and caregivers, equipping ourselves with the tools to understand, recognize, and support the mental well-being of young people is vital. Enter Youth Mental Health First Aid, MHFA courses. The alarming landscape of youth mental health. Child and adolescent mental health concerns are a global issue, and the UK is no exception. Data from the UK's National Health Service, NHS, and various mental health charities shed light on the gravity of the situation. Prevalence. According to the NHS's Mental Health of Children and Young People in England report from 2017, 1 in 8, 12.8%, of young people aged between 5 and 19 years had at least one mental disorder when assessed in 2017. Early onset. Mental health issues observed in adults frequently begin during the younger years. Nearly half of all adults with mental health conditions were diagnosed in childhood. Yet, less than half received appropriate interventions at the appropriate age. School impact. Reports indicate that children with mental health issues might miss out on school. The average is about 10 days more per school year, affecting their academic growth alongside their mental well-being. COVID-19 impact. Mental health services have seen a rise in referrals since the onset of the pandemic. Young Minds, a UK-based mental health charity, reported that the pandemic has exacerbated mental health issues for those who already had them, and has given rise to new mental health issues in individuals who previously didn't. Why youth MHFA courses? Mental Health First Aid teaches participants how to assist someone who is developing a mental health issue or experiencing a mental health crisis. Just as CPR training helps a layperson without medical training assist someone following a heart attack, MHFA training helps someone assist someone else who might be developing a mental health issue or experiencing a crisis. For teachers, a classroom is a microcosm of society. As educators, the responsibility extends beyond imparting academic knowledge. Recognizing early signs of mental distress, understanding how to approach a struggling student, and knowing how to guide them to appropriate resources can make a life-altering difference. For parents, understanding the nuances of adolescent mental health can be daunting. MHFA courses provide invaluable insights, enabling parents to differentiate between typical teenage behaviors and potential red flags, fostering open communication and building trust. The benefits as the school term begins. The start of the school year can be both exciting and stressful. New routines, academic pressures, and peer relationships can become overwhelming for some children and teenagers. Being MHFA trained at the outset. Early intervention equips adults to identify potential issues before they escalate. Building trust demonstrates a commitment to student well-being, fostering a supportive environment. Resource linkage ensures that young people get the help they need, when they need it. The mental health landscape of young people today is complex. But with the right tools and knowledge, we can create a safety net for them. By investing time in youth MHFA courses, we're not just adding another certification to our list. We're actively participating in building a mentally resilient generation. The start of a new school term is not just about buying new stationery or setting academic goals. It's also about ensuring that our young people have the emotional and psychological support they need. And as the saying goes, it takes a village to raise a child. Let's ensure our village is equipped, aware, and proactive. Are you ready to make a difference? Take a youth MHFA course today. Thanks for watching. Like, share and subscribe for more content.